What if one simple doctor's visit quietly set the stage for the biggest bombshell of the entire season? What if a prescription change, a small joke, and an awkward appointment are actually the soap opera world's way of dropping the most massive hint right in front of our faces? Because here's the thing. In the world of General Hospital, nothing is ever just a routine checkup. Nothing. And if you've been watching closely lately, you already know something big is brewing around Emma Scorpio-Drake. Something that could flip her entire world upside down and drag one very specific doctor right into the drama along with her. So sit tight, because today we're breaking it all down. And trust me, by the end of this video, you are going to have a lot of thoughts. Hey, welcome back to the channel. If you're a die-hard General Hospital fan, you are in the right place, because we are diving deep into some seriously juicy spoiler territory today. Now, I know what you might be thinking. It's just a doctor's appointment. How dramatic could it really be? Oh, my friend, you clearly haven't been watching enough soap operas, because in the world of GH, a routine gynecological exam, yes, you heard that right, can and absolutely will spiral into the kind of storyline that has you screaming at your TV screen at 11 o'clock on a Tuesday night. Today, we're talking about Emma Scorpio-Drake, Dr. Britt Westbourne, a birth control prescription switch, and the very real possibility that the show is quietly setting up one of the most classic soap opera twists in the entire playbook, a pregnancy storyline. And not just any pregnancy storyline, one that could involve a failed prescription, an unexpected twist of fate, and a certain young man named Giovanni Palmieri, who may or may not be about to become a very surprised father. Let's get into it. All right, so let's start from the very beginning, because context is everything here. In the May 7th episode of General Hospital, Emma Scorpio-Drake went in for her annual gynecological exam. Completely normal, right? Just a standard yearly visit. Nothing unusual about that. Except here's where it gets interesting. Emma's usual doctor, Dr. Frida Navarro, wasn't available. And the person who stepped in to cover? None other than Dr. Britt Westbourne. Now, if you know Emma's history with Britt, you already understand why Emma's reaction was less than enthusiastic. These two have a complicated past. There's tension there. There's history. There's a whole lot of emotional baggage sitting in that exam room along with them. So when Emma walked in and realized Britt was the one handling her appointment, she was not exactly jumping for joy. She wasn't thrilled about it at all. And honestly, you can't really blame her. When you have negative associations with someone, it doesn't matter how professional the setting is. That awkwardness is going to be there. But here's the thing. Emma didn't storm out. She didn't demand a different doctor. She took a breath, decided to be mature about the situation, and she stuck it out. And something kind of unexpected happened during that visit. Britt was actually helpful. Like, genuinely helpful. You see, Emma has been dealing with a bit of a side effect from her current birth control medication. Headaches, persistent, annoying headaches that just wouldn't go away. And Britt, being the professional that she is, recognized the issue and switched Emma over to a new birth control medication, one that hopefully wouldn't come with those unpleasant side effects. Before the appointment wrapped up, Emma scheduled a follow-up visit. And here's a small but interesting detail. Rather than going back to Dr. Navarro for the follow-up, Emma suggested returning to see Britt instead. Think about that for a second. Emma, the woman who walked into that room tense and reluctant, walked out comfortable enough to voluntarily request Britt as her follow-up doctor. That's a shift. A real shift. And it matters. Now, on the surface level, a lot of viewers might watch this scene and think, oh, okay, the writers are just smoothing things over between Britt and Emma. They're giving these two characters a chance to move past their old tension and maybe build something new, respect, maybe even a friendship. And you know what? That's a totally valid reading of it. That could absolutely be what's happening here. Soap operas are always layered. They do multiple things at once. A scene can serve 2 or 3 narrative purposes simultaneously, and the best writers use that to their advantage constantly. So yes, one purpose of this storyline could very well be a character development arc. Emma sees a different side of Britt. Britt shows that she can put professionalism first. They begin to rebuild or maybe build for the first time some kind of mutual respect. That's a perfectly logical story beat. But then Britt said something. One line, one small, casual, joking little line. And it has been living in the heads of GH fans ever since. Here's the setup. As the appointment was wrapping up, Britt made a little offhand remark. She said, and I'm paraphrasing here to keep things in our own words, something along the lines of, if the new medication doesn't work out, Emma is welcome to come back and tell her directly. She said it with a laugh, a little chuckle, like it was just a light-hearted way of closing out the visit, and most people would hear that and just smile and move on. But soap opera fans, we don't do that. We don't just move on. We replay that line. We analyze it. We look at it from 17 different angles because we know that in the world of daytime drama, throwaway lines are never actually throwaway. So let's look at that line from a different angle. Britt presumably meant, if the headaches come back, if the new medication causes problems, come find me and we'll figure it out. But what if the medication causes a very different kind of problem? What if Emma's birth control doesn't just fail to stop the headaches, but fails completely? Here's where we need to talk about something real for a second, because it's actually really important for understanding why this storyline has so much potential. Birth control medications, as effective as they are not 100% foolproof. No form of contraception is. And when you switch from one medication to another, there's a transition period, a window of time where your body is adjusting, where the old medication is leaving your system and the new one hasn't fully taken hold yet. That transition window, it matters. It can make a difference. And anyone who's ever switched birth control knows that it requires careful management and timing. Now, soap operas love this exact scenario. They have used it time and time and time again because it is the perfect storm of believable, dramatic, and deeply personal. It's not some wild, unrealistic event. It's something that genuinely happens to real people. And that relatability is exactly what makes it such effective storytelling. So when General Hospital devotes screen time to showing us that Emma is switching her birth control medication under the care of a doctor she has a complicated history with, it's hard not to read between the lines. Because if Emma ends up pregnant, every single viewer is going to remember this scene. They're going to connect the dots immediately, and they're going to have feelings about it. Big feelings. Now let's talk about the really fun part of this whole thing, because it's not just about the pregnancy possibility itself, it's about what a pregnancy would mean for the relationships around Emma. If Emma does end up pregnant and she starts questioning how it happened, her mind is almost certainly going to go to that appointment, to the prescription change, to Britt. And even if Britt did everything right, even if the medication switch was perfectly handled and the issue had nothing to do with the prescription itself, Emma might not see it that way. Emotion doesn't always follow logic, especially in the middle of a shock like an unexpected pregnancy. Emma could point the finger directly at Britt. She could be furious. She could show up exactly the way Britt jokingly invited her to, right to Britt's face, ready to lay the blame at the doctor's doorstep. And that kind of confrontation, that's gold for a soap opera. That's the kind of scene that gets clipped and shared and talked about for weeks. The irony of Britt's little joke potentially coming true in the most dramatic way possible would be the kind of thing GH writers absolutely live for. It would be layered, it would be emotionally charged, and it would give both actresses so much to work with. But let's not forget the other major piece of this puzzle. Because if Emma is pregnant, the conversation very quickly turns to the father. And that brings us to Giovanni, or Gio, Palmieri. Gio and Emma have been on quite a journey together on General Hospital. Their relationship has had its ups and its downs, its sweet moments and its complicated ones. And now, with all of this birth control drama quietly being set up in the background, the question of what comes next for these two is more loaded than ever. A pregnancy would completely reshape their dynamic. It would force conversations they might not be ready to have. It would bring a new kind of urgency and weight to everything between them. And here's the thing. General Hospital spoilers have already confirmed that Gio and Emma have more surprises ahead of them. The show has made that clear. Their story isn't wrapping up. It's building towards something. So what is that something? Could it be a baby? Could the next chapter of Emma and Gio's story be one they didn't plan, one that arrived in the most unexpected and life-altering way possible? It's looking like a very real possibility. Now, for anyone who might be newer to General Hospital or who just wants a little more background, let's zoom out for a second and talk about why this particular story matters in the bigger picture. Emma Scorpio-Drake is not just any character on this show. She carries a legacy. She is the daughter of Robin Scorpio and Patrick Drake, two of the most beloved characters in General Hospital history. Robin is a Port Charles icon. Patrick was a fan favorite for years. And Emma grew up in the middle of some of the most emotionally significant storylines the show has ever told. So Emma, stepping into her own major dramatic arc, one that echoes themes her parents dealt with in different ways, is a meaningful, full-circle moment for longtime fans. Britt Westbourne, meanwhile, has had one of the most complicated character evolutions on GH. She came in as an antagonist. She made enemies. She burned bridges. But over time, the show gave her depth. It gave her vulnerability. And she became someone fans genuinely rooted for, even while she was at her messiest. Seeing Britt in a position where she's trying to do right by a patient and potentially getting dragged into drama anyway, through no real fault of her own, is both dramatically satisfying and emotionally resonant. It honors Britt's growth while also creating a new conflict that doesn't erase who she's been. That's good writing. That's layered storytelling. And that's why General Hospital, even after all these years, still knows how to hook its audience. There's also something worth noting about how the show is using the medical setting here. Soap operas have always used hospitals and medical dramas as the backdrop for their most emotionally complex moments. Births, deaths, diagnoses. The hospital is where life changes happen on these shows. By setting this storyline in motion through a medical appointment, the writers are doing something very intentional. They're grounding the drama in something realistic, something everyday people can relate to. And then they're using that everyday moment to kick off what could be a truly life-changing chain of events. It's subtle, it's smart, and it's exactly the kind of setup that makes you feel clever for catching it, and then stunned when it pays off. So what does all of this actually mean going forward? Let's think through the possibilities. Possibility. Number 1. The birth control switch works out perfectly. Emma has no headaches, no problems, no surprises. She goes back for her follow-up, has a pleasant, or at least civil, appointment with Britt, and the whole thing serves primarily as a relationship reset between the two of them. The tension eases. Maybe a real, unexpected friendship begins to develop. That's a valid and satisfying outcome, and it would add a nice new dynamic to the canvas. Possibility number 2. Emma's birth control fails, not in a way she immediately notices, but in a way that results in a pregnancy. She discovers it, she panics, and her mind immediately goes to the prescription switch. She goes straight to Britt, furious. Britt has to defend herself while also navigating the incredibly sensitive situation of a patient who is shocked and scared and looking for someone to blame. This creates a massive ripple effect for Emma and Gio's relationship, for Britt's professional and personal standing, and for everyone connected to these characters. Possibility number 3. Something in between. Maybe Emma has a pregnancy scare without an actual pregnancy. Maybe the new medication causes a side effect that isn't a baby, but is still dramatic enough to cause conflict. In soap opera world, the near miss can sometimes be just as powerful as the real thing. Any of these directions is possible. But the clues, the setup, the dialogue, the deliberate focus on birth control and a prescription change all point most strongly toward possibility number 2 being the one the writers are building toward. And if that happens, buckle up, because the fallout is going to be enormous. For Emma, an unplanned pregnancy would be a seismic life event. At this stage of her life, with her relationship with Gio still finding its footing, a baby changes everything. It forces decisions. It reveals character. It creates stakes that can't be easily resolved. For Gio, it means stepping into a kind of responsibility that tests everything he thought he knew about himself and what he wants. For Britt, it means being at the center of a storm she tried to stay clear of, connected to a situation she may have had no control over, but that ties her directly to the drama anyway. And for viewers, it means an emotional roller coaster that we are absolutely going to be strapped into for months. That's the beauty of soap opera storytelling done right. One small scene, one prescription, one offhand joke, and suddenly the whole world of the show shifts on its axis. So here we are at the end, and I just have to say, I am so here for wherever this storyline is going. Whether it's a genuine pregnancy arc, a dramatic scare, or simply the beginning of a new and complicated relationship between Emma and Britt, the fact that the writers are planting these seeds so carefully tells me they have a plan. And if General Hospital has shown us anything over the decades, it's that when they have a plan, they know how to deliver. Emma's story is just getting started. Gio's role in her life is clearly far from finished. And Britt? Well, Britt never could stay out of drama for long. And honestly, that's exactly why we love her. Now I want to hear from you, because this is what makes this community so amazing. Do you think Emma is actually heading toward a pregnancy storyline? Is the birth control setup a real hint, or do you think fans are reading too much into it? And if Emma does end up pregnant, how do you think Gio is going to react? Drop your thoughts down in the comments below. Let's get a conversation going, because I genuinely want to know what you think is coming next. And if you're not already subscribed to this channel, what are you doing? Hit that subscribe button, ring the notification bell, and make sure you never miss another breakdown, spoiler deep dive, or GH analysis video. We post all the time, we cover everything, and we do it with the same love for this show that you have. Thanks so much for watching, and I'll see you in the next one. Take care.